morning, good morning. Just making sure this live stream is working right now. I'm gonna give it a couple of minutes. Not a couple, maybe 30 seconds. But in the meantime, we'll just add all the participants. Hope everyone's doing well. Let's just adjust this camera a bit here. That should be okay. All right, guys, so it's 9 a.m. We're gonna wait till 9:01 before we start. Again, we're in the second part of the semester today, so we're gonna look into myofascial lines with a bit more detail. Today, we're gonna touch upon myofascial lines, as well as begin talking about the superficial backline, which is the first line we're gonna talk about. It's pretty cool stuff. I know that a lot of you have heard about anatomical planes or myofascial lines before. So this is kind of a great way to get into a little more detail. I also find that this is not covered a lot in normal anatomical texts or classes. So it'll be good to kind of dive into this a bit more. Okay, so I think we'll get started now, and we'll just add everyone as a join. So again, hopefully everyone has had a good couple of weeks. I know we took a little break from last week. So we're gonna get started talking about the myofascial lines as well as the rules associated with the lines. And then the next part's gonna be getting into the superficial backline. So the very first myofascial line that we'll be discussing. Okay, coffee in, let's begin. So if you remember, guys, myofascial lines are these continuous tracts of tissue that are connected to each other. And because of that, they influence each other. If you remember from our last lecture a couple of weeks ago, we started talking about the science behind tensegrity and how we have both tensile and compressive components that pretty much connect everything together. Okay. In the human body, the tensegrity at the largest level is found in our myofascial systems, with the tensile components being the myofascia, so your muscles, your tendons, your ligaments, and the fascia itself, and the compressive units being the bones. Okay. So tensegrity and our myofascial lines are the reasons why I can make bold statements like this, like having really tight calves can influence neck pain or even provoke headaches. And a lot of people wonder, how the heck will your calves influence your head? Well, we will see kind of especially at the end of this lecture, a really cool example of how you can test this out yourself. I'm not going to say I'm going to provoke any headaches here, but we'll kind of put to the test how the bottom of a myofascial line can influence as far as the top of the same myofascial line. Okay. So the diagram over here to the right outlines some of the key myofascial lines that can be seen on the posterior aspect of the human body. We're going to get into a little bit of detail about the one that's coming across here. So the one that kind of goes straight down from the suboccipital region, traveling all the way down to the bottom of the foot. Okay. But in any case, myofascial lines have certain rules to them that must be followed in order to be considered a myofascial line or a track. Okay. So the first rule is that they must have a consistent depth to them. Okay, this means that we cannot have myofascial lines that just change depths abruptly within the myofascial line. Okay, so this means that you cannot go from your most superficial fascia or muscle to the most deep muscle or fascia. There has to be kind of a consistent depth that connects them and maintains their continuity. So what this also means is that we have different layers of myofascial lines too. So we have a superficial back line. We also have a superficial front line, but we have a deep front line as well. So depth really matters with myofascial lines, and going from a superficial point to a deep point usually disconnects them. Okay. Another rule is that these myofascial lines must have a consistent direction to them. This means that there cannot be abrupt changes in the direction of these lines, as this will break their continuity. There are some small exceptions to this rule that we'll cover a little bit later when we start talking about more of the arm lines. But in general, there has to be a consistent direction, okay? You can't just go vertically through a line and then all of a sudden go horizontally, right? Making like a 90-degree turn. There's just no continuity at that point, right? So that's the second rule. I didn't put the third rule here for some reason. My goodness. It's not really a rule, but sometimes we can run into the issue of intervening planes where there may seem like there's a continuity, but there's actually not. So it could seem like fascia is running along the same line, but they're not connected. And there are a few reasons why. We'll discuss that later. Another thing about myofascial lines is that there are the presence of both expresses and locals. So what do I mean when I say expresses and locals? Well, expresses are just another way of saying two joint muscles. And locals are another way of saying one joint muscles. So we have a combination of those two along the myofascial lines. Now, my next question is, and we'll see if everyone's awake, can you guys recall any two joint muscles? If you can kind of write them down in the chat or turn on your microphone and just speak them out. Let's see if you guys remember any of the two joint muscles that we have while I sip on some good dark roast coffee. Again, the question is, what kind of two joint muscles do you guys remember? We're gonna have to think all the way back to first year when we talked about simple anatomy. Okay, so not getting any answers yet. So we have a few, right? We have our hamstrings. Remember, the hamstrings, specifically the long head, crosses both the hip and the knee joint. We also have the biceps brachii. If you guys remember, the long head crosses the shoulder and the elbow. Some examples of one joint muscles. So one joint muscle can be something like your vastus medialis oblique. It could be your soleus. Your soleus is a one joint muscle. It only crosses your heel.
This is truck that the wipers broke on, right?
Yeah.
Sorry?
I just wanted to make sure because he said the car when he was explaining to me.
Oh, I
The
think
wiper stopped
the microphone on.
halfway up in the car.
Well, that happened before on the car, so he would know that. I would. I don't know. I'll ask him. I think it was the truck.
I just tried messaging him on Messenger. Sent him a schematic of the truck.
So yeah, some examples, other examples of two joint muscles include your rectus femoris. So the rectus femoris crosses the hip and the knee anteriorly, and we have our gastrocnemius too, which crosses the knee and the heel posteriorly. So those are some examples, guys. Okay. All right. So let's get into the superficial back line. So we have a couple diagrams here. The first anatomical line we'll be discussing is this one. It's not to say that this is the first or the most important. It's just the first one we're going to discuss. A simple way to describe this myofascial line is that it kind of connects and protects the entire back or the posterior surface of the body. Okay. So you see all this line shaded in blue over here. It starts from the top of the head and goes all the way down through your back, through your hip, behind your leg, behind your calves over here into the toes of the bottom of the foot. Okay, so it extends from the very top of the body to the very bottom. Now, if you look closely at this diagram over here, it even goes to this ridge over here where your eyebrows are. So pretty extensive myofascial line. Now we have a diagram of the right over here, and this is kind of the superficial black line that's completely dissected, okay? So someone literally took a scalpel over here and removed the whole entire line and put it over here for our viewing pleasure. Although it's not the most kind thing to the eyes, it's right there. Now, the first thing you'll notice is that even when you look at it anatomically, you have this one continuous line over here. Um, Now, at the top, we have the epicranial fascia, which is basically the top of your head. As we continue downwards in this dissection, we have the erector spinae, which is these muscles over here. Then we have the sacrotuberous ligament, which is this ligament over here. We have the hamstrings, and you can see both heads over here, which is down here. And then we have the gastrocs, which is another way of saying the gastrocs is a triceps surae. This is a combination of 3 different muscles in the calves, but for now we'll just say gastrocs. These are the muscles over here into the plantar fascia, which are the muscles and the fascia over here. So we always think of things like the hamstrings or your calves as separate units, but this dissection over here pretty much shows you that they're not just separate units. They actually operate as one continuous line. And that's the whole thing about the myofascial lines, is that there's this huge bridge, this continuity that connects everything together. And it just makes the anatomy of the human body that much more interesting. And this is where tensegrity really shines, because you'll see that all these tensile units are just all interconnected. Okay.
Excuse me?
Yep.
Going back to that previous slide,
Yeah, for sure.
if you stretch your calves, like let's say you're doing calf stretches, will it stretch all the way up to your upper back and everything because of this?
Yes and no. I mean, yes, in the fact that you are kind of yanking on the superficial back line. But it depends on which position you're stretching a calf, right? Like, we're going to talk about it a little bit later as to how you can really wind up the superficial back line. But if, let's say, you have really tight calves, the really tight calves can actually be yanking on your hamstrings and your back and your neck. So by stretching your calves, you can ultimately take some pressure off your hamstrings and your back. Right. So by stretching your calves, you can definitely influence the entire chain over here. So yeah, I guess the short answer is yes, it can actually influence the entire superficial backline. And the common thing I get from a lot of my back patients, and I think I actually even posted a TikTok video about this. I don't know if anyone's on TikTok, but one of my common complaints about my desk workers is they're sitting for long periods of time in this curved posture. They get up and they feel back pain. And so the one thing I tell them is you probably have tight hamstrings, right? Because when you're sitting like this for long periods of time, your hamstrings are so shortened. So in my TikTok video, I just get them to go to a wall, lie down on their back, throw their leg up against the edge of the wall, and get them a really good hamstring stretch to relieve their back pain, not their hamstring pain, their back pain. So that is why the superficial back line is so interconnected, right? Stretching your calves can influence your back and even your neck. Okay.
Awesome, thank you.
No worries. So in the previous slide, we kind of saw that simple dissection of the superficial back line, and those are the tensile components of the tensegrity of the human body. But remember, the other part of tensegrity is the compressive components, right? Otherwise known as the bones of the human body. So over here, we kind of have a simple overview of all the bony stations, which are seen here as these blue dots, as well as the myofascial tracts, which are seen more as these blue lines of the superficial backline. Okay, so the bony stations are the attachment points to which the superficial backline, the myofascial line, makes a small stop to anchor itself a bit more onto the skeleton. Okay, I'll say that again. The bony attachments or the bony stations are the attachment points to which the myofascial line makes a small stop to anchor itself to the skeleton of the human body. Okay, this does not mean that there's any loss of continuity in the myofascial lines, by the way, guys. Just think of them as stations where the myofascial line can anchor to the human body and provide some more support, but there's still that continuity, right? And we'll get into more details about all the structures involved as well as the attachment points a little bit later, maybe the next lecture, not this lecture. Okay, so all these numbers and whatnot will be discussed later, but this is just to kind of elucidate what the bony components, the compressive components of the tensegrity of the myofascia is. Okay, so the next portion of the lecture, we're going to be talking about a little more of the function of the SBL. So SBL is just short form for superficial backline. Now, one of the main functions of the superficial backline is to support the body in a fully upright position. And it does so by preventing the tendency of the body to curl into more of a fetal position, which can be seen in the leftmost diagram over here. So you see our very, very tired individual curling forward. Back goes into this kyphosis over here. So that nice little curvature over here. This actually puts the superficial backline in more of a stretch. Okay. Now, since we need to keep a relatively upright position throughout the entire day, as seen in the right diagram over here, you can imagine that these muscles of the superficial backline need to be constantly working isometrically to maintain our posture. Right? I say isometrically because we're not actually contracting and extending our spine throughout the entire day, or else you'd just be doing this the entire day. But the muscles are in some sort of contraction where it's isometric, so it prevents you from constantly curling forward and succumbing to the force of gravity. Okay, so this is why we tend to see a higher portion of slow twitch, endurance type muscle fibers throughout this whole entire muscle myofascial line. Because if this wasn't the case, it'd be way too exhausting to maintain an upright posture, right? So we need those endurance fibers, those marathon type of muscle fibers to help keep that upright posture, because we got to be upright throughout the whole entire day while we were awake, right? On top of that, we also tend to see more heavy duty bands of fascia throughout the whole entire superficial backline. And this is there also to provide that support to our posture. So these fascial units include components like our Achilles tendon, our sacrotuberous ligament, our thoracolumbar fascia. And these fascial units are tough because they provide an additional level of support to prevent that forward curl on top of what the muscles of the superficial backline already do to support us. Okay. Any questions about that so far, guys? Okay, perfect. So the next function of the superficial backline is to provide movement. Okay. So the overall movement pattern of the superficial backline is to create both extension and hyperextension. Now, there is one exception to this rule for the superficial backline, and that's at the level of the knee. So the knee is the only point to which the superficial backline will actually cause flexion. So it's the hamstring, and when the hamstring contracts, it flexes the knee, it doesn't extend the knee. Otherwise, the rest of the superficial backline will cause extension to the body. Now, the superficial backline predominantly causes movement in the sagittal plane, so the forward and back plane. It doesn't really cause much lateral or rotation type movements. It's more concentrated on your sagittal movements. And it does so by either limiting forward movement, so preventing that forward curl, or exaggerating your backward movement. So really getting that nice extension to your upper back, lower back, your neck, your hips. Oops. But this extension function of the superficial backline is also seen throughout the development of the human being. Okay, so during infancy, for example, the superficial backline initially helps the child lift their head from the fetal position, right? We know that the fetal position is that really highly curled forward posture. It's very protective. Fetus is developing, but over time, the SBL will allow the head to kind of lift up, right? Now, progressively, this allows the fetus that develops into a child to support themselves while they're on their tummies, being able to kind of observe their environment using their eyes and their head without constantly being fixated to the floor. Okay. Now, once we achieve the ability to stand on our 2 feet, the SBL also helps us extend backwards as needed. And this is on top of being able to maintain our upright posture, like we mentioned in the previous slide. Okay. So it could be said that because we started out in a very flexed position, our gradual maturity as human beings and our gradual aging is actually coupled with the development and the strength of our superficial backline. Okay, so as we kind of progress, our superficial backline is actually working alongside us to kind of get stronger as well. Okay, whereas we already start with a very tight and strong superficial front line, which is something we're going to talk about in later lectures. Does that make sense so far, guys? Or are there any questions? Okay. Okay, so let's look at the implications of the superficial backline. Now, although we speak of the superficial backline in singular terms, we actually have a set of 2 of them, one on each side of the body. So if we go back to the previous slide over here, you'll see that we have one along either side of the body. So there's not one, there's 2 of them, but they both kind of function bilaterally. Okay. Because we have a set on either side, imbalances can typically be observed. There can be overuse of the spinal erectors on one side of the body versus the other, for example. And this can be caused from things like an imbalance in how you distribute your weight when you sit on a chair or when you stand. So for example, if I'm sitting and I'm using my mouse on the right side and I tend to lean on the right side, maybe my screen's on the right, you can imagine that all my weight's going to my right. And so what we find is that the right superficial backline might be a little more fired up. Okay. This could also be caused from movement dysfunctions or previous injuries that led to compensations where one superficial backline could be tight at one point and the other superficial backline could be tight at another point, right? Other common issues or postural implications associated with the SBL are what I've kind of outlined in the slide over here. So number 1 can be a dorsiflexion limitation, right? So this is when the ankle has a limitation in its ability of bringing the top of the foot any closer to the shin. Now, when the SBL is particularly tight near the lower extremities, this limitation is often seen. A dorsiflexion limitation puts you at a higher risk of developing conditions such as plantar fasciitis, and it makes things like squats a bit harder to do. Oddly enough, practicing a deep squat is also a great way to restore dorsiflexion range of motion too. So the problem is sometimes the solution too. If you can't squat because of a restriction in your ankle, squat to restore the restriction in your ankle, right? So that's another kind of thing to think about. Number 2 in this slide is what we know of as knee hyperextension. So this is the problem of the knees being overextended. And I could bet you guys can already imagine some people that stand like this. So you can see kind of where the center of gravity is. It's neatly centered in this knee over here. But with the individual who has a high level of extension in their knee, you see that their knee moves behind the center of gravity, which is never a good thing. Okay, so a few things we know about knee hyperextension is that it puts the joint itself at a higher risk of degenerative change. Why? Because the two joint surfaces, when you're in highly extended position, get closer to each other, right? So there's less space between the joint, putting you at higher risk of causing degenerative change in the joint itself, okay? Number two, it also puts your ligaments that support the knee, like your ACL, for example, under more stress. Now, if you remember, guys, things that stress the ACL include knee hyperextension, okay? So when the ACL is under more stress, you're pretty much increasing the likelihood of any type of strains or sprains happening to the ligaments when the wrong movement occurs, when you're playing sports, when you're let's say doing a leg press and you're overextending your knees. Right? These are some of the things that can cause problems when you have knee hyperextension. And this is where the SBL is commonly causing issues when it becomes a little too tight. Okay. Number three in this diagram is what we call an anterior pelvic tilt. And that's when that pelvis is rotated forward and your lower back goes into that lordosis, aka that hyperextension. Okay. Now, when we do have a great deal of anterior pelvic tilt, we know a few things. First, the joints of the lumbar spine are under more compressive stress, which puts you at a higher risk of joint inflammation and irritation, leading to very focused back pain. We also know that the core muscles anteriorly, so the front of your body, including your rectus abdominis and your transversus abdominis, are in a weak and lengthened position, right? So when you're in that anterior pelvic tilt, you can imagine that your core is a little more stretched out. This puts them in a very weak and poor position to be able to support you, right? That's why bracing your core by tucking your tummy in when doing something pretty heavy duty on the body is often recommended to help support your back. Okay. Now, number four on this list is called upper cervical hyperextension. This is the predicament where our head's kind of poking forward. It's also known as forward head posture. But if you look at this diagram over here, the very top of your cervical spine goes into that extended posture. So you get a lot of extension over here. Okay, this really occurs when the muscles of the SBL, the superficial back line, right underneath the base of the skull, called these suboccipital muscles, are increasingly shortened and tight. And this is a very common one in all my desk workers who bring their heads close to the screen when using it, or all my guys using their phones who are just kind of getting that tech snack because they keep their head in that position for way too long. These are the implications that lead to tightness in the superficial back line. And we know how hard it is to get out of that position once you spent years in this position, right? Any questions about any of these implications so far?
Yes.
Go for it.
Can you explain how to fix number 2 and number 3?
Okay. So fixing number 3, we'll start with number 3. Of the things, it really depends on what's leading to the anterior pelvic tilt, right? So if there's a lot of tightness in the superficial back line at the level of the low back, it could mean that the core is weak. And so doing things to strengthen the core anteriorly will help influence that position of the anterior pelvic tilt to a more neutral position. So that's one. Number two, an anterior pelvic tilt can be caused by a lot of tightness in the hip flexors that just anchor the pelvis down. So doing things to lengthen the hip flexors, maybe even strengthen them, because strengthening doesn't mean it's going to cause it to get short, can lead to relief of that anterior pelvic tilt. In terms of the knee hyperextension, some of the things you can look at is why it's happening in the first place. This can be just really, really tight quads or hamstrings that are just not firing up the way they should. So you can do things that strengthen the posterior chain a little bit. Or you can do things to kind of release the front chain, so releasing the quads a little bit, right? So those are some of the things that you can do to fix those two predicaments. Hopefully that answers the question for you.
Yeah.
Okay. All right, so let's start talking about the components of the SBL. And to describe the components, we begin in the inferior most aspect of it. That's not to say that the foot is the starting point of the SBL. Force transmission can begin through the foot. However, it can also begin at the level of the neck or even midway through the SBL at, let's say, your lumbar erectors, right? So we don't start here because this is the fundamental starting point. We start here because of simplicity's sake, okay? Okay, so over here we have the underside of the foot, including your plantar fascia, as well as the muscles and the tendons of your toe flexors over here, okay? The 5 bands of the plantar fascia seen here, so 1, 2, 3, 4, 5, kind of blend into this one thick band that runs into the front of your calcaneus, aka your heel bone. And it turns into something called your plantar aponeurosis. It's a very, very thick band of tissue that also picks up at the 6th band over here from the base of the 5th metatarsal. And it kind of blends into this lateral edge over here. Okay. Now, these fascia and associated muscles pull lengthwise, longitudinally, across the bottom of the foot, kind of like the bow and an arrow seen on the right over here. Okay. So this effect causes both the distal and the proximal portions of the foot to get closer to each other, creating your foot's longitudinal arch. Kind of like that bow and arrow, right? So if you think of the rope portion of the bow, that's like the muscles and the fascia of the foot, and the wooden portion is the arch. Think of it that way, guys. Okay. So it's important to note that the plantar surface of the foot, so this surface over here, is often the source of problems that communicate with the rest of the leg. Okay. This can lead to issues like tight calves, hamstring issues, anterior pelvic tilt. It kind of communicates up the entire line. And we're going to talk about in the next slide why that's the case, and a pretty cool test to see if there is any source of that. Another thing to note about the plantar fascia is that tightness throughout the entire plantar fascia can sometimes be unevenly distributed, right? So this means is that if there's more tightness relatively in the medial bands, you'll often get a foot that's slightly a little more curved. If there's more tightness in the lateral bands, you might get a foot that's a little more flat. That's not always the case, but that's typically what we see. Okay, so there's a lot of nuances in the details about where the tightness occurs that can influence the position of your foot even. But all this constitutes the very inferior most portion. Oops. All this, sorry, constitutes the very inferior most portion of your plantar fascia. Let's see if you guys can still see me on the camera there. Yeah, sorry, my camera just fell. So here's the cool part about the superficial backline I find. It's always the aha moment that I give to a lot of my clients. And this is a great way to see how well and how interconnected the entire SBL is. So we do this pretty cool test that involves both a ball, it could be a tennis ball, golf ball, lacrosse ball, as well as a stretch, okay? So first you need to find someone to test this on. You can test this on yourself, right? But it's important to also get someone else to test this on so you can actually visualize the potential changes that occur with this test, okay? So the first part of this test on the very left involves getting your test subject to keep their knees straight and kind of just completely collapse downwards to a full forward bend. And you're practically getting them to see how far they can get forward. Keep in mind, you don't want to do this test on anyone that has any back pain at the moment. Okay, so find someone that doesn't have too much back pain. Now, when you get them to do it, ask them to hold the position and try noticing a couple things when this happens, right? First, look at the contour of their back and look at it from the standpoint of whether there's any differences between the left side or right side. Look for if one side may be a little bit higher than the other side when they're reaching for the floor, okay? The next thing I want you guys to look for when doing this test is where the resting position of the hands are, okay? So if you look at this diagram, for example, in this individual over here, at least, we can safely assume that the right hand's hanging a little bit lower than the left hand, okay? The third thing I want you to kind of consider is getting your test subject to draw their attention along how this position feels to them on the back side of the body. So get them to pay attention to how their back feels, how their hamstring feels, how their calf feels, and just get them to feel for any differences. Okay, awesome. Now, the next part of the test involves getting your test subject to find that ball and roll it deeply into the plantar fascia of the foot for about 2 to 3 minutes. And make sure they cover the entire surface of the foot. So get them to kind of roll it out pretty deeply. Ask them to look for that sweet pain. Get them to really roll that foot out, okay? Now, the next thing you're gonna do is not try the other foot. Forget the other foot for now. Have that one foot rolled out and you're gonna retest that position. So you're gonna get them to do the forward bend again, and you're gonna observe for any changes in the contour of their backs, as well as any changes in their hand position. Okay. You're also going to ask them if there's any difference in how they feel in this position right now. In most cases, you'll actually see a pretty dramatic change in how one side feels and how it looks and moves versus the other. Okay. Now, instances where you're not going to see as much of a change include people who have a pretty strong scoliosis. You may not see a big difference, but in most cases, you'll see a pretty big difference. Now, the point of this test is to highlight how just treating the bottom of your foot with a bit of myofascial release can influence how low you can get to the floor, how much less stress you'll have in your back when you do this test. Right? It's pretty cool. I highly encourage you guys to try this out. Now, don't forget to get your test subject to eventually even this out by doing the other foot. Okay, you don't want to treat one foot but leave the other foot hanging, right? You don't want to keep them nice and asymmetrical for no reason. So after you do the first test, get them to roll out the other foot and then retest the forward bend test to see if it evens out the treatment results from the test. Okay, so this is a pretty cool thing to try. Maybe you guys can try it out this week and let me know how it goes next week. In any case, this is kind of the teaser into the superficial backline. Next week, we're going to be talking about most of the other components of the backline as we move from the bottom of the foot into the calves, into the hamstring, into the pelvis, into the low back, into the neck, and then into your head. But we're going to stop right here for now. If you guys have any questions, I've opened the floor for the next 5 to 10 minutes, depending on who asks questions. But in any case, thank you so much for tuning in. It's nice to see everyone again. If anyone did miss the Zoom class, the live stream is working today. We got it to work, thankfully. So that's going to be available for a playback for anyone that may have missed a portion of class or the full class. But in any case, I'm here if you have any questions, guys. Thanks, Sarah. You have an awesome weekend as well. We'll see you guys next week. No problem, Jad. Alrighty. Once again, thank you guys so much for tuning in, and we'll reconvene next week.